Hello students, welcome to Dr. B.R. Ambedkar Open University. I am Dr. Mohammad Sarosh Ahmed and today we are going to learn about the basics of anatomy and physiology to understand the human structure and function. Let's go through these slides. Today you will be learning by the end of this session how to define anatomy and physiology, understand their significance in hospital administration, identify key anatomical and physiological terms, relate structure and function in healthcare management. Yes, so let's begin with what's the significance for you as a student, as a future administrators of hospitals. Anatomy and physiology is the foundation for clinical decision making. It enables effective communication with healthcare teams. It supports safety, infection control, and ergonomics planning. It guides facility design and emergency preparedness and helps in quality audits, accreditation process, and patient-centered planning. For example, you can see the planning of placement of patients with respect to the doctors doing the rounds. This is all as per the planning of anatomy and physiology knowledge. Let's learn the meaning of anatomy. Anatomy is a study of structure and relationships. It's a Greek origin, that is, ana means up and tome means to cut or cutting. It literally means to cut up, like we do in the dissection. It helps visualize body parts and their organization. How do you apply this knowledge of anatomy is you can design the wards, you can have the operation theatre layouts planned out, and how to handle the patient effectively. For example, they could have bed sores, and you need to handle them carefully. All right, so this is like the skull. You can see the anatomical structure. Like that, we also can use this knowledge and similarly organize the operation theatre. For example, in this photograph you can see. Right? Now let's quickly see the classification of anatomy. One is the gross anatomy, which you can see it's microscopic. There's a visible structure. Okay, like you have the brain, which is visible. Okay, when you see it, then all the hands, limbs, the skull, all are visible. This is gross anatomy. Then microscopic, it literally means you need a microscope to look into to identify it. But it's also called histology, the study of tissues and cells. And this is how it looks like. The cells all in the pink and bluish colors, making a beautiful artwork, and that's placed in every tissue. And you have the systemic and regional anatomy, which the organs and areas are put in. And this is, for example, the heart, the systemic anatomy. And then you can also classify anatomy as radiological anatomy or image-based anatomy, which is very relevant to you. Okay, the systemic and the radiological, you need to be well versed. Okay, so let's go deep into anatomical orientations now. It's very important that you understand the positioning of a human body. Okay, we start with the standard anatomical position, which is taken as a reference posture. And we can define the directions. Okay, when a doctor or a team member of a hospital is conversing with you in superior, inferior, anterior posture, don't be confused. It's simple. Superior means above, inferior means below, anterior is in front, posterior is behind. Okay, now the planes also we'll try to understand. There are certain planes and some new terms which are given up. For example, sagittal. Sagittal is like cutting into right and left half. A plane, imagine an imaginary plane dissecting the body and making into two halves, that is right and left. That is sagittal plane. A coronal plane otherwise is front and back. You have the anterior part and the posterior part divided when you imagine a coronal plane passing through your body. And there's something called transverse, just like horizontal plane, okay, which has superior inferior division. So if you see, CT scans are very good in giving transverse plane cut sections of organs, body structures, which is very helpful in diagnosing. Same way, MRI has an extra edge wherein it can talk about the sagittal planes, coronal planes, as well as transverse planes. So this is how the sagittal plane looks like. Now let us see the coronal, which I talked about. Just imagine an anterior part and the posterior part being divided, and you can able to see two different and study it in detail. Similarly, we have a transverse, like I said, horizontal cut section of human body, and that what it is, transverse plane. Now the medial and lateral. Medial means towards the body and lateral means away from the midline of the body. It's very simple. So I would say my little finger is medial, whereas my thumb is lateral, okay, away from the body. To understand simply, proximal is something called like near and farther. For example, if I am considering the elbow joint, you have this as proximal and the farther part as a distal, farther from the trunk. Okay, same way the supine and the prone. Okay, these are some positions when a person lies down in a supine posture, and that is you're lying down with the face up, and you have a prone posture wherein a face down position is taken. In many of the endoscopic procedures, the patient is allowed to are made to lie down in a prone posture. Similarly, a lateral position, for example, giving a spinal anesthesia, the patient has to be put in lateral position, either right or the left lateral. And there is a famous lithotomy position wherein a mother assumes this position to deliver a baby, right? So these are what we've just talked about, and this is the photo which will allow you to understand in simple ways the superior, inferior, anterior, posterior, okay, and this is made very simple by this, I hope so. And I talked to you about all the positions of lying down. This is the top one is the supine, then this is the prone, this is the prone, and then the lateral and the lithotomy. All right, yes. Now let us go into the movements and the postures as well. The flexion is like you have the two bones and a joint here, and it is flexing, and now this is extension. Okay, flexion and extension are other terms which we use in medical terminology. This is simply put in this diagram, you can see here, and then extension is the joint is extended, the angle is opened up, increased. This also flexion, extension. Okay, and then we have this abduction and adduction. Easy to understand. Adduction, ADD, that is moving towards the body, closer to the body. The action which moves closer, adds up to the body is adduction, which moves away from the body is abduction. Isn't it simple? You can see this here. You can see the limb, it's moving away, it's called abduction, and the limb, if it's moving towards the body, it's adduction. Okay, and there's something called rotation and circumduction. Circumduction, if you can see in the diagram, I'm showing it to you, wherein you have multiple freedom for the joint to move in different way from fixed point. Okay, all the rotation plus flexion, extension, all in one, like that's called circumduction. And rotation is simply put left and right rotation of the skull, and then you have the lateral and medial rotation of the limbs. As you can see in this picture, lateral is like away, like I said, medial is towards the midline. That kind of rotation is called medial rotation. Then supination and pronation, like I said. And to remember this, I would say pronation, P, just make it into B to understand, like blessing, as if your hand is turned around as if it's blessing. This position is called pronation, and superior, like above, is like supination. Okay, and then let's look at the gross anatomy. The different parts of the human body is simply by looking at, you can see the parts like head, neck, thorax, abdomen, groin, the legs and the hands, isn't it? Now further deeper than what you already know, these are the important areas of the abdomen, wherein the central umbilical area, where the umbilicus is there, you call it as umbilicus region. I'll just put the pointer so that you can also learn this. just now beside that is called lumbar region, the left lumbar and the right lumbar region, and then above umbilicus is called epigastric, below umbilicus is called hypogastric. Epi means above, gastric means stomach or intestine, and just below is the hypogastric. Then we have rib cage here, right, and that is cartilages. So left hypochondriac region and the right hypochondriac region is on the right and left side of epigastric region. Same with the last part, the most bottom part of the abdomen is the iliac region. If it's on the left side, we call it simply as left iliac, or the right iliac if it's on the right side. So by this way, if there is a pain in the right hypochondrium, you can suspect appendicitis or a gallbladder issue. If it is on the left hypochondriac, some stomach issue, acidity, or epigastric also. Similarly, the stomach is lying just behind this region. You can diagnose earlier by this. Okay, now we'll dive a bit deeper now. So all these organs, you already know it, just we'll go through it quickly. The brain on the top in the skull, then you have the thyroid gland, the lungs, the heart, liver, then you have the stomach and then intestines, and then you have the urinary bladder. Okay, so that's about the anatomy part. Clear? Now we are going to the second part of our class, that is physiology, which is very, very interesting, wherein anatomy has told you about the structures, what all are there. Physiology talks about what do they do, what function these organs do. Okay, okay. Now we have this physiology means the study of body functions and mechanisms. Okay, in Greek, physis means nature and logos means study of. Okay, so it explains, physiology explains how organs maintain life processes. It is a foundation for understanding clinical monitoring, wherein body always tries to keep itself in an equilibrium of homeostasis. That's the physiological part. Okay, we'll learn more about homeostasis in coming slides. Now imagine this is a cell, that's the anatomy of a cell. Now what function that each organelle in the cell do, that is the physiology. Okay, the nucleus is the brain of the cell, if you remember. That is a structure and it has some functions which it controls the entire process of the cell. Okay, next is the heart. For example, the structure is a heart, or organ is a heart, is anatomy, and the pumping of the blood through the valves and how much it's pumping and the rate it is pumping is physiology. And this knowledge is required for monitoring of patients. Now the levels of organization. Okay, we have the basic cell as a basic unit of life. The cell, multiple cells are put on together to form tissues, and with the tissues, many tissues together will form an organ, like a stomach in this example, and the stomach and the other organs continuously form the organ system or digestive system, for example, in this. And then you have entire organs put in one human body, and that is the organism. This is how you learn the levels of organization from the cellular level, the tissue level, the organ level, system, and the organ system or organism. All right. So each level builds on the previous. So it is analogous to hospital hierarchy, right? You have a hospital administrator, you have a staff working in the hospital, to all of them working in departments. So multiple departments will make up a whole institute or hospital. That is how even our human body is made of. And allow me to introduce some of the physiological terms, like homeostasis, which means internal stability, like it's like a balance, like a seesaw balance. Okay, if there is a stimulus, okay, triggered, if stimulus is triggered, like a high temperature outside your body, like in summers, okay, the body wants to cool down to maintain the temperature internally. It doesn't want to increase the temperature of the body, right? To maintain this temperature, what we do, the human body has a feedback mechanism, such as negative feedback mechanism, in which the body starts reducing the temperature by producing more and more sweat. So sweating happens as a feedback, and this is a function of a human body called homeostasis, where the temperature of the body is maintained. All right. The stimulus receptor effector control mechanism, very interesting thing which you need to remember. Imagine you looking at an apple. An apple could be a stimulus, for example. Eye sees the apple and this goes to the visual cortex in the brain. It informs and decision takes a decision. I want to pluck this apple, for example. So if that is a decision, the brain decides, and then your arm, the muscles of the arm, the biceps and the triceps all act in unison, and you can reach out to the apple and pick it. Okay, so the stimulus, that is apple, effector, and you have the receptor which is receiving the information, and effector which is doing the effect. So this stimulus receptor effector is simple to understand, and it is a control mechanism how the brain is controlling all your bodies and to make decisions. Okay, so feedback mechanism, like I just gave an example, we'll learn that in detail now. There is something called negative feedback, like I said, a temperature regulation, and a positive feedback also. So before going to the positive, like I said, if there's a temperature high outside, then body tries to cool down and tries to reduce the temperature by asking the sweat glands to produce more sweat and cool down. Okay, now there's something called positive feedback also happening. Let's learn about that. So when does it happen? When imagine a full-term baby, that a full-term pregnancy wherein 9 months have been completed and the baby is ready to be delivered. So what happens is the head of the baby descends down and the uterus and goes and stretches the cervical canal, and thus stretching results in giving a stimulus to the brain. The posterior part of the pituitary gland acts up and provides a positive feedback by producing hormones, oxytocin. It goes again down and increases the contraction of the muscles of the uterus so that the baby is pushed faster. So more the baby descends, more the oxytocin is released, and this is a positive loop, positive feedback mechanism which is happening, which is helping in childbirth, which is a very essential part. So now, isn't it interesting, right? So this is how physiology works. So there are vital parameters, like you measure you measure the heartbeat indirectly by seeing the pulse. You can use the pulse oximeter. You can measure we measure simply by putting your 3 fingers over the lateral border of your hand, okay, and then feel it for 60 seconds, and that will give you the heartbeat levels. And then you can also measure the blood pressure by using a sphygmomanometer. This is the pulse oximeter, just I wanted to show you also, wherein oxygen levels and pulse rate can be easily calculated, seen by just using a technological device. Then you have the BP measurement done by sphygmomanometer. Multiple are available, the mercury ones and non-mercury ones, electronic ones, wherein we use pressure to identify what the pressure of the blood vessels is, right? And there is something called respiratory rate also you can measure. Now let us, whatever we have learned so far in physiology will apply now, okay? That is in cardiac physiology. It is the knowledge of cardiac muscles or the pumping of the heart is essential to decide on ICU and the monitoring for the patient, to place the machines in the ICU, which place, how the bed should be placed. All these are decided by the knowledge of physiology. For example, you can see in this, okay, the devices which measures blood pressure, oxygen and heart ECG and all are placed next to the bed. Similarly, respiratory physiology, like the oxygen systems, we'll learn in detail about this, wherein you might have observed there are some white sockets, black socket, yellow and blue. Colorful sockets just behind every bed of a patient in an ICU who is admitted, right? What are those? A white socket has a socket. When connected to a pipe, when it is on, it can give out oxygen. okay, and it's connected to the oxygen cylinders outside or the oxygen machinery. Then you have the black socket, which is the air. Yellow is for vacuum, which can be used to suck the secretions of respiratory system and help the patient. And there's a blue, which is nitrous oxide, which is for famously known as laughing gas, used for anesthesia purposes or relieving pain during deliveries especially. So this is the oxygen air system. I hope this is clear. Now we have the renal physiology as well, that is, which involves a dialysis machine and the fluid therapy, wherein we have to remove the toxins, remove the extra fluids and do the work what the kidney does. Yes, this is what it looks like, the dialysis machine. It has a dialyzer which can help in maintaining the homeostasis. It can maintain the osmolarity of the blood vessels, the blood, and it allows the movement of the fluids outside the blood into the machine, thereby removing the excess fluids. Okay, and this is how the knowledge of physiology is used to create such a machine in first place, like a dialyzer or dialysis machine. Then we have in neuro department the neurophysiology, wherein it really helps and making a difference in emergency and rehabilitation. Let's go further and apply this to design the facilities around the patient's anatomy, that is ergonomics. Ergonomics simply means how to help the workers prevent injuries by fitting the right work to the right person. Okay, so this knowledge of anatomy and physiology is highly essential to design the facilities. And yes, and design an operation based on human limits. For example, you can also plan how the layout of the hospital would be, where the reception should be. Should it be the entrance or at the back or the first floor, second floor? You might have been observing in several hospitals you might have visited already, wherein the planning is done in several different ways. So, but if you see, reception is in the first place, right? So, and the physiotherapy department, the orthopedic department, where patient cannot commute or climb up stairs, or if the lift doesn't work, so you probably would require orthopedic and physiotherapy departments to be together in the ground floor where patient can easily access. The knowledge of anatomy and physiology would help you in designing such. It therefore enhances patient safety and efficiency. It helps to schedule based on physiological recovery cycles. If there are some patients who require longer care, like orthopedic ward, if you see patients with the plasters and they would require a longer time, so that number of beds would be required for that ward. And some patients just fever for 2 to 3 days, they take a treatment and they go. The recovery is faster than different departments. So based on the anatomy and the physiology knowledge, you can also predict how many patients would be coming or requiring beds, and based on the recovery cycles, how the rotation should be done. I hope it's making sense. Okay, now to procure equipments according to functional relevance. So if you want like cardiac machinery, it needs to be put in cardiology department or ICU department with a cardiac setup put in, right? So when you know the anatomy of a heart, the physiology of a heart, and the machines which are relevant to the heart, okay, thereby you can plan accordingly and have the equipments, order the equipments and use them. Okay, so let's take more examples so that it becomes very clear that the anatomy and physiology is so critical. For example, in designing the ICU, understanding the respiratory physiology guides placement of the oxygen lines, ventilators and negative pressure zone. Okay, so in several hospitals we see the beds and the lines of the oxygen air system just behind it, so that longer pipes are not required. A short pipe would be sufficient, and thereby you can continue the treatment and give the care. Okay, even the ventilator placement is critical. Ventilators are machines like artificial lungs. Okay, just like dialysis is artificial kidneys, same way ventilator manages the pressure and provides the oxygen and does the oxygen carbon dioxide exchange automatically. So these machines are crucial, and this machine is invented by the knowledge of physiology. And there's something called negative pressure zones in a hospital. Can you guess what zone could be that? Which department could be that? Okay, so the departments wherein you have patients who could be very infective, or isolation wards especially, wherein you don't want the air circulation to be in and out. So negative pressure zone would be only the air is allowed inside and it cannot go out, it cannot leave out. So that kind of a negative pressure zone is required in such areas. So if you want that air to go out, you need to use HEPA filters so that you can control it and prevent that infection from going out and affecting the healthcare workers, the patients who are coming there, the relatives of the patients who are coming there, right? So by that we reduce the hospital acquired infections, also known as nosocomial infections. So now I hope this negative pressure is simple for you. Next example is in operation theatres, and awareness of body positioning such as supine, pro, lithotomy. This helps the planning the table types, the lighting angles, and the instrument placements. Okay. In emergency departments, the knowledge of vital organ location such as the heart is on the left side, lungs are bilateral on the thorax, not in the abdomen, right? So and the abdomen helps in prioritizing the trauma cases and locating essential diagnostic units like CT, X-ray in the near to the casualty area, not far, right? You want them to be near to the casualty area. All right, so we'll take one more example. So in anatomy and physiology application, imagine you are entering a hospital. Like I said before, you just see around and look at what departments are there. Okay, you have a reception at this start, then you have the cafeteria, you have the waiting hall, then you have the OPDs. Okay, is there a ramp, designing the ramp for a wheelchair person who requires help? Okay, and you have a lift access nearby, the stairs. Okay, there's emergency exit. All this structural parts of a building is based on the knowledge of anatomy and physiology, like the human body, where the movements to be done, and as per the function, the machinery which you need to procure, which you need to order to make it really efficient. That helps in improving the quality of the care that you provide to the patient, and thereby reduces the injuries, reduces the mishappenings in the hospital and the clinics. I hope this knowledge helps you and makes you a better learned in anatomy and physiology. Thank you for listening.